Okay, no more going to the toilets now. Let us finish the class. Okay. So today we'll be starting about the external carotid artery along with its branches. So this has been your fourth theory class for the day. So just finish it off like a story. Okay. Try to learn the whole topic in the class itself. We'll go very slow, but at the same time we will try to finish each and everything. See, first of all, let us try to understand that how this artery structure begins in our body. Okay. So let us consider that the heart is a manufacturing hub. What it manufactures? It produces, it helps in pumping blood. Okay. Now, since the heart is producing, not actually producing, but for the time being, let us think that the heart is the manufacturing unit of the blood. Okay. Now, if it stores the blood, then its part is also is that it supplies the blood to the whole body. Now, it has given certain responsibility to certain major structures. For example, in any company, there are certain CEO, then distributing manager, managing managers, regional, regional manufacturing officers, they are there, right? Similarly, the heart is present in the central part of our body. Suppose let us consider that there is a manufacturing unit in your central part of India. Suppose in Madhya Pradesh. Okay. Now, suppose this is a mobile company. We name it Mobile X. Now, this manufacturing unit that is present in Madhya Pradesh, its sole purpose is not only producing mobiles, its purpose is also to distribute the mobiles. For this part, it has given certain responsibilities to certain individuals. So it has suppose there are two CEOs, okay? Two CEOs, and there is a bonding in between the CEO. What is the help of this bonding? That this CEO says that whatever unit is being produced by the manufacturing unit will be distributed in the northern part, western part, and eastern part of India by three RMOs, regional manufacturing officers, okay, or distributing officers. What is its responsibility? That it supplies the mobile to the western part of India, then to the northern part of India, then to the eastern part of India. And this portion, it has taken the responsibility to supply all the mobile phones to the southern part of India. Okay? So, in the same manner, our heart also works. So, the heart has your ascending aorta, your arch of aorta, and your descending aorta. In the same manner, what it does, so this is the heart. It has ascending aorta and descending aorta. In between them, there is a common junction, that is your arch of aorta. What happens? Whatever blood is being pumped by the heart has to be supplied to the upper portion of the body by this arch of aorta. For this purpose, it gives certain branches. One is your subclavian artery, then your brachiocephalic trunk. Okay, these are two subsidiary artery. Let us see in this picture. Here you can see from the arch of aorta, one brachiocephalic trunk comes, and one your left subclavian artery and your left common carotid artery comes. Okay. So from the arch of aorta, your left common carotid artery comes, your left subclavian artery comes, and your brachiocephalic trunk comes. Right? From this right brachiocephalic trunk comes your right common carotid artery. Right common carotid artery. And your right subclavian artery. These two arteries originate from your brachiocephalic trunk. Now, as you can also see in this picture, right subclavian artery and your right common carotid artery. Now, what is the function of the subclavian artery? what is the function of subclavian artery? It supplies the muscles of the hand. Try to remember from your upper limb class that this very subclavian artery was continuing as our axillary artery, then dividing into your radial and femoral artery, and then supplying all the muscles of our upper limbs. This subclavian artery. Now, this common carotid artery, your right common carotid artery, remember that it originates from the from the brachiocephalic trunk. But on the left side, there is no brachiocephalic trunk. The common carotid artery, that is the left common carotid artery, arises directly from the arch of aorta. Okay. Now, this common carotid artery, these two common carotid arteries, that is your right common carotid artery and the left common carotid artery, goes upwards and divides into your two different artery. One is your external carotid artery and your internal carotid artery. Okay. See, this common carotid artery going upwards and upwards, and at the level of your upper border of your thyroid cartilage divides into your external carotid artery and your internal carotid artery. Okay. So similar thing happens on your right side and similar thing happens on your left side. So from common carotid artery, that is your arch of aorta, two artery arising, one is your right common carotid artery, another is your left common carotid artery, going upwards up to the neck, and in the neck it is dividing into your external carotid artery, right external carotid artery, and your left external carotid artery, then right internal carotid artery and left internal carotid artery. Why the name external carotid artery? Because it is supplying the external part of the face. That is, the external carotid artery is supplying mainly the face part and your neck part, and the internal carotid artery is supplying in your brain part. Okay, it is supplied by your internal carotid artery. So today we will be studying only about the external carotid artery. Let us just finish this part also. See, so we have talked about the ascending aorta. Okay, so basically this ascending aorta is producing all the arteries for supplying the upper portion of the body, that is your face, neck, your two upper limbs. But this descending aorta is supplying, giving branches to supply the lower portion of your body. So try to remember from your lower limb classes that this very descending aorta was continuing as your thoracic aorta in the thorax region, giving off the bronchial arteries, esophageal arteries, mediastinal arteries, so and so. Then in the abdominal region, this was continuing as your abdominal aorta. This abdominal aorta was again giving branches such as the celiac artery, superior mesenteric artery, inferior mesenteric artery, then continuing as your iliac arteries, femoral arteries, popliteal arteries, your tibial arteries, so and so, into your lower limb. Okay, so now coming to the external carotid artery part, it extends from the upper border of the lamina of the thyroid cartilage behind the neck of the mandible. Okay, and it terminates into the substance of carotid gland, into your superficial temporal and maxillary artery. So basically we were talking about that the common carotid artery was dividing into these two branches, external and internal carotid artery, at the upper border of your thyroid cartilage. Okay, so from the upper border of the lamina of the thyroid cartilage, it ascends upwards and goes behind the neck of the mandible. Mandible has been covered, right? So from the neck of the mandible, behind the neck of the mandible, it goes upwards and terminates into the substance of parotid gland. So here is your parotid gland. So in the substance, that is the flesh of the parotid gland, this artery terminates. Okay, and finally from the surface of the parotid gland, it comes out as your superficial temporal and your maxillary artery. So now before this thing, one thing to tell again, that is your carotid pulse. So here you will see that here you can easily feel one pulse, that is your carotid pulse. Okay, this is one of the most constant pulse in our body. Even in shock patients also, you will see that even if the radial pulse you cannot identify, but the carotid pulse you can feel. How to identify? So basically from the sternoclavicular joint, this is your sternoclavicular joint, 4 cm upwards from here, you will start feeling this carotid pulse. And as you ascend upward, this artery is very much superficial, so you can just keep on feeling the pulse. So here basically we feel the pulse. Okay, are you able to feel? Try to see side by side. So basically from your sternoclavicular joint 4 centimeter upwards, here you can feel this carotid pulse. Okay. Now the external carotid artery is anteromedial to the internal carotid artery in the lower part, but anterolateral to the internal carotid artery in its upper part. What I am trying to say that this is your internal carotid artery. So in the beginning of the journey, you will see that this external carotid artery is present anteriorly and medially. Okay. Now as it goes upwards, it becomes antero. It is still anterior, but it turns lateral. So in the lower part, it is anteromedially present to the internal carotid artery, and in the upper part, it is anterolaterally present. Okay. So it forms a curve-like pattern in this way. Curve-like pattern. Now here, as you can see in this cadaveric image, so this is your common carotid artery. Basically, this is your common carotid artery. From this common carotid artery at the upper border of your thyroid lamina at the level of your C3, C4 vertebra. Okay, it divides into your external carotid artery and your internal carotid artery. And in the earlier part, in the lower part, the external carotid artery is present anteriorly and medially. And in the superior part, it curves like this, it becomes anterolateral. Now coming to the individual branches. So now the external carotid artery will give certain branches to supply your face and neck region. What are these branches? So there are total 8 branches. In the name external, you will find 8 alphabets: E, X, E, T, R, N, A, L. 8 letters. So similarly, there are 8 branches. So 3 are your anterior branches, 3 anterior branches, 2 posterior branches, 1 medial branch, and 2 terminal branches. Now, don't just mug up these things. Try to understand what it is happening. The external carotid artery is going like this. Okay. Since the external carotid artery is going like this, what will be the anterior branches? It will be all these branches that will be supplying the anterior structure. So here in the anterior region, there is our thyroid gland. So one of the artery will be supplying the thyroid. Okay. Then another will be supplying the tongue, that is the lingual artery. And the third artery will be supplying your face. So these are the 3 anterior branches. The external carotid artery going like this, giving of 3 branches. One supplying the thyroid, second supplying the tongue, third supplying the face. These are the 3 anterior branches. Now 2 posterior branches. So this is the external carotid artery. 2 posterior branches will be one your posterior auricular artery, another one will be your occipital artery. Okay, one is your posterior auricular artery, another one will be your occipital artery. These are the 2 posterior branches. Superiorly, there will be maxillary artery and your temporal artery, superficial temporal artery. So here also in front of the tragus, this is your tragus, this is the ear, this is your tragus. In front of the tragus, you can feel another pulse. That is the pulsation of your superficial temporal artery. So here is your superficial temporal artery. So these are the 8 branches. So anteriorly supplying the thyroid, lingual means tongue, and your face. Posteriorly supplying the area posterior to your ear, that is the posterior auricular artery, then your occipital artery. Superiorly your superficial temporal artery and your maxillary artery. And on the medial side, here is your medial side, it will be supplying your ascending pharyngeal artery. So where are your pharynges? I mean pharynx. Pharynx is present medially. Here are your tonsils. In front of the tonsils, there are pharyngeal walls. So on the medial side, it will be supplying the pharyngeal. I mean, it will be giving the ascending pharyngeal artery. So 3 anterior artery, 2 posterior artery, 2 superior artery or terminal branches, 1 medial artery. So these arteries will be given by both the right-sided external carotid artery as well as your left-sided external carotid artery. Now suppose this superior thyroid artery is being given by the anterior branch. I mean, it is one of the anterior branches. Now the superior thyroid artery will be having multiple branches to supply the thyroid as well as the other structures. See, here this is your superior thyroid artery. It will be going somewhat forward and downward, okay, and laterally. So this is your superior thyroid artery. It arises from the front of the external carotid artery, just below the your genu of your thyroid bone. Sorry, greater cornu of your thyroid bone. So which one is the greater cornu? So this is the greater cornu of your thyroid bone. Here is your thyroid bone. So this is the greater cornu of your thyroid bone. So the external, the superior thyroid artery will be arising from the lower portion of your cornu, greater cornu of your thyroid bone. Okay. Then it runs downwards and forwards, parallel and superficial to the external laryngeal nerve to reach the upper pole of the thyroid gland. See here. So this is your, here will be your thyroid gland. See, here is your thyroid gland. So now I am seeing the structure like this. Imagine the cadaver like this. You are viewing like this. So here is your thyroid gland. Here is your common carotid artery giving the external and the internal carotid artery. So common carotid artery giving the external and the internal carotid artery, and the anterior branch. So this is your anterior branch, one of the anterior branch, that is your superior thyroid artery going downwards, forwards and laterally. Now supplying the thyroid gland. If you see, there is another branch. See this nerve, external branch of your superior laryngeal nerve. So this is the external branch of your superior laryngeal nerve. So in the superior part of the course of the superior thyroid artery, this external branch of your superior laryngeal nerve is present in close proximity with the artery. So now in case of thyroidectomy surgery, that is your thyroid surgery, the blood supply to the thyroid gland has to be cut. So to cut the blood supply of the thyroid gland, I need to ligate this artery. Now what happens? If I ligate this superior thyroid artery on the upper pole, then there is chance of injury to this external branch of superior laryngeal nerve. See, here both these structures are close with one another. So if I ligate here, ligate the artery here, so I can injure this external branch of your superior laryngeal nerve. Now in the lower part, see both these structures go apart from one another. So if I tie the same superior thyroid artery just before entering the thyroid gland here, then there is less chance of injury to this nerve. So that is what done by the surgeon. So whenever doing thyroid surgery, surgeon finds the superior part of the thyroid gland and ties the superior thyroid artery just before entering the thyroid gland, not in the upper pole, to avoid injury to the external branch of your superior laryngeal nerve. Now this superior thyroid artery gives off certain important branches. Obviously one branch will be glandular branch supplying the thyroid gland. Then your cricothyroid branch, superior laryngeal artery and your infrahyoid artery. So these are the certain branches of your superior thyroid artery. This infrahyoid artery will be anastomosing with the infrahyoid artery of the other side. So just try to remember these arteries. This will not be that much asked in your theory papers. Some of the vivas will be maybe asked, but not for theory purpose. This is not that much important. Just try to remember external carotid artery and its branches, major branches. Now coming to the lingual artery. This is another anterior artery. So it arises from the front of the greater cornu of your thyroid bone. So below the greater cornu of your thyroid bone goes your superior thyroid artery, but in the front there is lingual artery, which will be supplying your, which is the main artery to supply the blood to the tongue. This is your lingual artery. Now this lingual artery is divided into three parts by your hyoglossus muscle. So there is one muscle which is originating from your hyoid bone and supplying the base of the tongue, that is your hyoglossus muscle. So this hyoglossus muscle is dividing this lingual artery into three parts. From the first part arises your suprahyoid artery. So the infrahyoid artery will be arising from your superior thyroid artery, but the suprahyoid artery will be arising from your lingual artery. Okay. Then from the second part will be arising your dorsal lingual arteries, which is usually 2 in number on each side. So here also you will see two dorsal lingual arteries. Basically it supplies the dorsum of the tongue. So it supplies the base of the tongue. Okay. This dorsal lingual arteries. Then another artery is your, from the third part arises your sublingual artery. So this is the sublingual artery. As the name suggests, it will be supplying the sublingual gland. So here is a sublingual gland. So here the sublingual gland will be supplied by your sublingual artery. So from the lingual artery, arising you from the first part arising your suprahyoid artery, second part arising your dorsal lingual artery, from the third part arising your sublingual artery, and these three parts are divided by the hyoglossus muscle. Okay. Now coming to the facial artery. So facial artery is one of the main artery of our entire external carotid artery branches. Earlier it used to be called as the external maxillary artery, but leave this term. Now it is called the facial artery. It arises from the front of the external carotid artery just above the tip of the greater cornu. So this is the greater cornu. From the lower part is arising the superior thyroid artery. From the junction or at front of the greater cornu is arising your lingual artery, and on the superior part is arising your facial artery. That is how much important the greater cornu of hyoid is there. Now this facial artery will be supplying muscles of the neck as well as your face. Okay. So the face will be supplied by the facial artery as well as the neck. So the neck region the neck region will be supplied by the cervical part of the facial artery, and the face region will be supplied by the facial part of your facial artery. Okay. So the facial artery is divided into the cervical part supplying the neck, facial part supplying the your face. Now this cervical part, since it is present in the neck, so it will be supplying all the structures that is present in the neck only. So ascending palatine artery will be supplying your palate, so palate of the mouth, soft and hard palate. Tonsillar artery is the main artery of the tonsil. So tonsil is present here. So the tonsillar artery is present. Tonsillar artery will be supplying the tonsil. Glandular, that will be glandular branches. So the glandular branches will be supplying all the surrounding glands, and your submental artery will be supplying the submental region. Now, basically the submandibular gland. The submental artery will be supplying the submandibular gland. Okay. Now coming to the facial part, in the face, the inferior labial artery will be supplying the lower part of the lip. The superior labial artery will be supplying the upper part of the lip. Lateral nasal artery will be supplying the lateral part of the nose. Muscular branches will be supplying all the muscles of the face. Okay, these are the branches of the facial artery. Cervical part supplying the neck region, and the facial part supplying the face region. Now coming to the occipital artery, since as the name suggests it is one of the posterior branch, it is present just like opposite to your lingual artery. Okay, where is your lingual artery? It will be present in front of your. So this is your occipital artery. So here there is your lingual artery. Occipital artery will be present just opposite to your facial artery. So the facial artery was arising from the upper part of your greater cornu. So just opposite to it will be your occipital artery. So this is the facial artery, this is the occipital artery. So it will be supplying major portion of the back of the head. So this major portion will be supplied by your occipital artery. Now, one of the branches is your sternomastoid branch, that will be supplying your sternomastoid muscle. Then mastoid branch will be supplying your mastoid air cells. Here is your mastoid air cell. So this mastoid air cells will be supplied by the mastoid branch of your occipital artery. Then there is meningeal branches will be supplying the meninges, dura mater, pia mater, arachnoid mater. Then muscular branches will be supplying the muscles of the posterior part of the head. Auricular branches will be supplying the ears. Then your descending branch divides into your superficial and deep branch. Now posterior auricular artery is another posterior branch. It will be having again stylomastoid artery. This stylomastoid artery basically supplies your middle ear. So the middle ear has three ossicles, malleus, incus and stapes. This will be supplied by your stylomastoid artery. So there is a foramen known as stylomastoid foramen through which this stylomastoid artery passes, and it supplies your middle ear. Auricular branch again supplies the ear, and then occipital branch. Now the medial branch, that is your ascending pharyngeal artery, has these branches, that is your pharyngeal and prevertebral branches. So basically in the pharynx region there is pharyngeal fascia, prevertebral fascia. So these will be supplied by your pharyngeal and prevertebral branches. Again here will be your meningeal branches again. Then inferior tympanic branch, basically supplying the tympanic cavity. Where is the tympanic cavity present? In the ear, okay. So the tympanic cavity tympanic membrane is present in the ear. So this tympanic membrane will be supplied by your inferior tympanic artery. Then your palatine branches will be supplying your palate, soft and hard palate. Now coming to the superficial temporal artery, that was your one of the terminal branch. So as it goes upwards, it will be giving transverse facial artery, anterior auricular artery. Since it is going like this, it will be giving anterior auricular artery, zygomatico-orbital artery, middle temporal artery, anterior and posterior terminal branches. And maxillary artery is one of the most important branch of external carotid artery. So it will be taken in another class. So this maxillary artery, it also gives many branches like this. So we came to the last part. So just let us go through the whole topic in 2-3 minutes. Basically from your heart arising your ascending aorta, descending aorta. In between this ascending and descending aorta is your arch of aorta. From this arch of aorta, we are getting brachiocephalic trunk, and your left common carotid artery and your left subclavian artery. Now from this brachiocephalic trunk, we will again get right common carotid artery and right subclavian artery. So one thing you remember here, that this right common carotid artery is arising from your brachiocephalic trunk, which is branch of your arch of aorta, and this left common carotid artery will be directly arising from your arch of aorta. Okay. Now this right common carotid artery and left common carotid artery on either side will be giving your external carotid artery and your internal carotid artery. So this is the left external carotid artery and left internal carotid artery. Similarly, right common carotid artery will be giving you right external carotid artery and your right internal carotid artery. This right and left external carotid artery will be giving 8 branches. Let us just write external carotid artery, considering both right as well as left. So this external carotid artery will be giving 8 branches, 3 anterior branch, superior thyroid artery, then your lingual artery and your facial artery, 2 posterior branch, occipital artery, posterior auricular artery, 1 medial branch, that is your ascending pharyngeal artery, and 2 terminal branches. One is your superficial temporal artery, another one is your maxillary artery. So these are the 8 arteries. Okay. Now all of these arteries will be giving further arteries, further branches. So as I have already mentioned, just try to remember up to this level. Okay, that will be more than sufficient. Then if question, because other than this, each of the individual arteries will not be asked in the exam. Okay, so try to remember up to that much, and after that the individual artery, go through them once and make a table. Okay, make a table and go through them, these arteries one by one, and try to understand the topic rather than memorizing the topic. Memorization part is only this much, that what are the branches of your external carotid artery, as well as the course of the external carotid artery. Other than this, try to understand these things, and then it will be easy to write in the exam. Okay, that's all.